Dr. Toor from Amplify Eye Care here in Olympia, Washington. Today we're going to go over the difference between dry and wet macular degeneration. Now, both forms of macular degeneration typically affect patients, I would say 60 to 65 plus, and both of them are also in the macular region of your retinal tissue in the back of your eye. So the macular region is responsible for your central vision, your colored vision, kind of the details you see in the vision. So dry macular degeneration typically has these little deposits that form under your retinal tissue. That just indicates that that retina in that area is not functioning as well as it's supposed to, and it creates these little waste deposits in the back of the eye. And then wet macular degeneration actually can have waste deposits, but the main thing that makes it wet is that there are unstable new blood vessels that end up growing into the retina because it's unhealthy tissue, and these blood vessels tend to leak fluid and blood and create a more drastic change to your vision. So typically most patients have dry macular degeneration. A small percentage can convert to wet, and the wet is the one that has more kind of visual impacts on your central vision. Not saying that dry can't, but usually dry macular degeneration impacts kind of maybe blurry vision. You might have some distortions if you look at kind of a straight line. You might see some kind of wiggle or distortion in it. And typically for most patients, we have them monitor with a grid that's kind of looks like this, and it's called an Amsler grid. And we have you close one eye, do it one eye at a time, look at that center dot, and then look for any kind of distorted, blurry portions of your vision there. And then you want to check with the other eye. And we have patients do this periodically just because typically the changes are going to happen one eye at a time. And so the other eye does a pretty good job of overcompensating for the affected vision. And so it's important to look for those subtle changes there. And of course, if you are noticing changes, it's important to come get it looked at from your eye doctor to see if there's anything that can be done about it. Now, with dry macular degeneration, there's nothing that we can do in terms of getting rid of any of the waste or damage that has occurred, but there are a few things you can do to prevent or slow down the progression. So wearing sunglasses is kind of the first step there, just because some of the UV light can cause that progression. And then also at a certain stage, it's beneficial to take AREDS 2, which is a multivitamin kind of complex that they've created specifically for macular degeneration that'll help that retinal tissue function the best that it can. And then lastly is smoking or don't smoke, because smoking is the one that's linked the strongest to progression of macular degeneration. I believe it's around 3 times higher risk of progression. So not smoking or at least cutting back as much as you can is what's going to help the most for your retinal health. And then wet macular degeneration usually has a little bit more of aggressive treatments just because we want to stop any of the leaking of those blood vessels. So the most common kind of treatment at this point is injections into the eye, which sounds scary, but that is so that the medication can go directly into the back of the eye and have an effect on those blood vessels. And it usually has some very good results in terms of stopping the leaking and preventing damage to happen in the back there. Of course, if you're noticing any changes or if you think you're at risk, it's important to get it looked at by your eye care doctor, just because the early stages, you might not actually pick up on vision changes, whereas we have more specific tests that we can run to look for macular degeneration. Thanks.